Awaking during surgery is called intraoperative awareness. This is sometimes occurs even in major surgery, and it is rare complication of general anesthesia. So what will be symptoms that appear on patient during awareness? What is causes and risk factors of this awareness? Don't forget to subscribe. First, I will tell about symptoms that will appear on patient after awareness during surgery. Patient will feel noises, conversation in operating room, having muscle paralysis, sensing pain associated with intubation or surgery, feeling anxiety, helplessness, or an impending sense of doom. We recognize patient awareness by patient movement, tachycardia, hypertension, tachypnea as of vascular access. One more thing, patient under anesthesia are paralyzed if neuromuscular blockade drug or type of muscular relaxant has been given. When paralyzed, patient may not be able to communicate their distress or alert the operating room staff of their consciousness until the paralytic wears off. Causes and risk factors. For certain operations such as C-section or in hypovolemic patients or patients with minimal cardiac reserve, the anesthesia provider may aim to provide light anesthesia and should discuss this with the patient to warn them. During such circumstances, consciousness and recall may occur because judgment of depth of anesthesia are not precise. The anesthesia provider must weigh the need to keep the patient safe and stable with the goal of preventing awareness. Sometimes it is necessary to provide lighter anesthesia in order to preserve the life of the patient. Light anesthesia means less drugs by the intravenous route or via inhalational means, leading to less cardiovascular depression, hypotension, but causing awareness in the anesthetized subject. And another one is muscle relaxant. The biggest risk factor is anesthesia performed by unsupervised trainees and the use of a medication that induces muscle paralysis, such as dexamethasone or non-depolarizing neuromuscular blocking drugs. During general anesthesia, the patient's muscles may be paralyzed in order to facilitate tracheal intubation or surgical exposure. Abdominal and thoracic surgery can only be performed with adequate muscle relaxant because the patient cannot breathe for themselves. Mechanical ventilation must be used. The paralyzing agent does not cause unconsciousness or take away the patient's inability to feel pain, but does prevent the patient from breathing, so their airway trachea must be protected and their lungs ventilated to ensure adequate oxygenation of the blood and removal of carbon dioxide. And the third one is patient physiology. Very rare causes of awareness including drug tolerance induced by the other drugs. Some people are more resistant to effect of anesthetic than other factors such as younger age, obesity, tobacco smoking. Long-term use of certain drugs includes alcohol, opioids, amphetamine. Stay happy and healthy.